Hello everybody, and welcome to another edition of Nutrition 101. Today we're going to be discussing fluids, electrolytes, and antioxidants. And this is going to encompass a discussion of water, as well as a number of mineral elements that we need to consume. And it's going to expand on our discussion of some of the vitamins that we talked about last time, as well as introducing the concept of antioxidant activity. And then this will be the material that is covered by the midterm exam. And quiz 4 will cover this and the previous lecture on vitamins. After the midterm, I will post the final project, which will be due at the end of the semester. And we will start discussing more specifics about cardiovascular and bone health, physical fitness, maintaining a healthy weight, and the nutrition of life cycles, starting with pregnancy and infancy, moving through childhood and adulthood, and then on into the later years. This will bring us to the end of the semester, and we will hopefully have a lot of fun along the way. So, water. It is everywhere, and most people, especially in the United States, don't get enough of it. And if they do get enough of it, it's often accompanied by a large amount of sugar. Our bodies are mostly water, so here is a chart showing the percentage of various nutrients in the body for a 135-pound female. 58% of their body weight is water, 23% is fat, 14% is protein, and 5% is minerals. Now, minerals includes all of the trace minerals and major minerals that we have talked about briefly, and most of this is in the form of calcium phosphate, which makes up your bones. However, a large portion of our bones is actually protein, which is why the mineral percentage is so low. This is another visualization of that same set of facts. A 150-pound man is 90 pounds of water, 30 pounds of fat, and 30 pounds of protein, carbohydrates, vitamins, and minerals. So bodily fluids have a number of functions. They carry nutrients and waste products throughout the body because they are the fluid in which all of the other molecules are dissolved. It also is a liquid, so that it has a definite volume, which allows it to exert pressure and create the feeling of firmness in our tissues. It also participates in chemical reactions, and in addition to carrying nutrients and waste products throughout the body and as a circulatory system, it is also the solvent for all of those things and the solvent in which reactions occur. In general, fatty substances are also dissolved in water, but they're surrounded by water-soluble proteins. We talked about this when we talked about fat digestion. Fats are typically dissolved in the blood in the form of something called chylomicrons. And one of the main functions of water in our body is to protect and lubricate our tissues. So we have cerebrospinal fluid, which protects the brain and spinal cord. We have amniotic fluid, which protects a developing fetus. The synovial fluid lubricates our joints. We have tears for our eyes. We have saliva for our for our esophagus and our mouth. We have pleural fluid, which is what greases our lungs up, allowing them to expand and retract without friction. Fluids are also how we maintain our core body temperature, because water has a high specific heat, or high heat capacity, so it requires a lot of energy to change the temperature of water, which helps hold our body temperatures at a constant 98.6 degrees Fahrenheit. We do this by sweating, which releases heat via evaporation of water. And this process is shown here. You have heat in your core, which is transported to your skin via capillaries and blood vessels. And the blood moves near the surface. The heat is transferred into the skin, which then evaporates sweat from the surface, and this consumes energy. And then the water leaves your body. Another function of bodily fluids is the maintenance of blood volume. So if you don't have enough water in your body, then your blood pressure will go down, which will cause issues for you. The blood volume is regulated by the kidneys, and this is related to the presence of sodium in your blood. So if you don't get enough or too much sodium, it can interfere with the way your kidneys regulate your fluid balance. In normal circumstances, if you have too little fluid, your kidneys will trigger the thirst mechanism in your hypothalamus. If your blood volume rises, then your blood pressure will increase, and this can be caused by overconsumption of sodium, which will cause you to retain water and will cause water to flow out of cells into the extracellular fluid, which makes the blood volume go up, increases the blood pressure, and increases your risk factors for heart disease and stroke. On the converse, low blood pressure can cause people to feel tired, confused, or dizzy, and is therefore equally dangerous. This is a picture of the way that fluid is distributed in your body. So first we have cells, where we have the intracellular fluid, which is the fluid inside of the cell membrane, and the extracellular fluid, which is outside of the cell membrane. And then in a tissue, for like the liver, for instance, we have a cell with intracellular and extracellular fluid, but this is fluid that is within the tissue between the cells, and so we call it interstitial fluid. And then there is a third situation where you have a capillary network, and so the blood cells themselves have intracellular and extracellular fluid, which is the plasma inside of the blood vessel, which is extracellular fluid also for the blood vessel wall cells. Now the thirst mechanism for blood volume goes down. Our hypothalamus is triggered, which prompts us to drink. This is generally triggered by a number of things. The first is that the concentration of salts and other minerals in your blood will increase when you become dehydrated, and this will trigger your thirst mechanism. Another thing that can trigger the thirst mechanism is if your blood volume goes down due to profuse sweating, vomiting, diarrhea, or low fluid intake. So overconsumption of salt or underconsumption of fluids. And another thing that can make us feel thirsty is the literal dryness of our mouth and throat because we don't produce enough saliva to lubricate. This causes our kidneys to release antidiuretic hormone, or rather, causes the hypothalamus to release antidiuretic hormone, which signals the kidneys to retain water. Now, this is all fairly technical, but at the end of the day, how much water do you really need to drink? Now, your water needs vary greatly depending on whether you are physically active or not. So if you're exercising, it's generally recommended that you consume 8 to 12 ounces of water 15 minutes before you exercise, and then 3 to 4 ounces every 10 to 15 minutes of exercise. That's probably a lot more water than most people are used to consuming, because a lot of athletes try to lose water weight to make weight for competitions and things, or to just motivate themselves to work harder. However, weight that you lose as water is unhealthy weight to lose. In general, it's recommended that you try to drink back every pound that you lose during exercise from loss of water, because the biological effects of dehydration are much more severe and damaging than the body weight that you would keep. So the general rule of thumb after these things are taken into consideration is that you want to divide your weight in pounds by 2 to get the number of ounces of water that you need to drink. So if you weigh 150 pounds, then you divide that by 2 to get 75, so you need to drink 75 ounces of water, which sounds like a lot. However, if you don't drink that much, then you will almost certainly be suffering from chronic dehydration. The best way to get water is to drink just water, and if you are very physically active and you're sweating a lot, you need to replace your electrolytes, and so you might want to choose a mineral water, but you also want to choose drinks that are lower in sugar so that you don't overconsume calories in the process of hydrating yourself properly. So this is a table of the various ways that water is gained and lost by your body. In general, we need to gain most of our fluids from liquids like drinks, and then another large portion from our food. Very little of it comes from the actual metabolism of nutrients, but in general we want to get between 1,450 and 2,800 milliliters a day, which is, in American units, 5 to 10 8-ounce glasses. Now this is due to the fact that we have to balance the water that we lose, and we lose water in our kidneys due to urination, between 500 and 1,400 milliliters, and then we lose water from our skin, a very significant amount, 450 to 900 milliliters, and then we lose air through breathing in our lungs, and also in our feces, because if we had feces that had no water in it, it would be agony. Here's a prettier picture of that same piece of information. The numbers here are slightly different. This is a newer graphic, so I'm guessing that, and also this person looks fairly active, so they probably need a bit more water than the average person. This person is consuming 2,200 milliliters of water, of beverages, and 500 milliliters of water from food, and then is getting another 300 milliliters from metabolism of sugars, fats, and proteins, getting a total of about 3,000 milliliters. And they are excreting all of that in the form of urine, in the form of sweat and water vapor from the lungs, and in the form of feces. So there are, just like any nutrient, there are symptoms of deficiency and symptoms of toxicity of water, because as some people may have heard, there are a number of cases of people drinking far, far too much water and then reducing the amount of electrolytes in their blood to unsafe levels. So one of the symptoms of deficiency is dehydration. This can take the form, this generally takes the form of weight loss due to reduction of blood volume. And as the more dehydrated you become, the more severe the symptoms are. So at 1 to 2% weight loss, you experience thirst, fatigue, weakness, vague discomfort, and loss of appetite. At 3 to 4% weight loss, you start to experience impaired physical performance, dry mouth, reduction of urine, flushed skin, impatience, and apathy. Once you get to 5 to 6% weight loss, there is difficulty in concentration, headaches, irritability, sleepiness, impaired temperature regulation, and increased respiratory rate. And 7 to 10% weight loss, you experience dizziness, spastic muscles, loss of balance, delirium, exhaustion, and collapse. So all of these symptoms are things that you may have experienced at one time or another, and a lot of people, they just have the instinct of, oh, I'll take an aspirin and I'll be fine. In general, you'll probably experience more relief from drinking the glass of water with the aspirin than you are from the actual aspirin, because if you have dehydration-related symptoms, the aspirin isn't going to do anything for you. The only thing it's going to help is drinking water. And it's amazing how much of a difference drinking water can do when you feel like garbage. Here's a table It shows basically the same information with slightly different numbers. The point is, if you get down to this much body weight loss, down to 10 to 11%, you're at serious risk of kidney failure. And you can get a rough estimate of how hydrated you are by looking at the color of your urine. So severe dehydration, if it's brown or dark yellow, then you should absolutely be drinking more water. And you should probably continue to drink water until you are full of water, over and over again until your urine changes color. If it's this color, you are minorly dehydrated and you should still continue to hydrate. Once it gets into the light yellow category, then you are adequately hydrated. If you go up into totally clear, you may have overhydrated and you can back off a bit. And if you are trying to get water from your food, this is a list of a number of foods that have a lot of water in them. And it sort of makes sense if you think about how these foods are consumed, why they would be consumed in large quantities, especially in a culture where we don't get enough water in general. So iceberg lettuce and cucumbers, you eat a nice salad, and it's full of, in addition to being chock full of vitamins and minerals, it is full of water, and you hydrate yourself just by eating it. Another one is peaches or pineapple, which is why you eat these on a hot day and it makes you feel good. They also are loaded with vitamins. Interestingly enough, olives have a lot of water in them, and as do sweet potatoes, and meat has a decent number of water in it as well, but nuts generally don't. Now, of course, just like anything else, you can overconsume water, and if you drink too much water, you can experience something called water intoxication, which most often happens either by overconsumption of water, by chugging water after becoming severely dehydrated, or through the administration of hypotonic IV solutions that are not properly balanced with the blood's salinity. Other things that can cause water intoxication are hypothalamic tumors, which interfere with fluid retention, as well as concussions, because the hypothalamus is in the part of your brain that could easily be affected by a concussion. And another thing that can happen is an excessive secretion of antidiuretic hormone for whatever reason. This is accompanied by abdominal cramps, dizziness, lethargy, nausea, vomiting, convulsions, and a possible coma. So don't force feed yourself water. So we've talked about water, but water would not be nearly as interesting if it didn't have a bunch of cool stuff dissolved in it. And most of the cool things that can become dissolved in water that our body needs are shown here. So the big ones that are found in our nutritive macronutrients are hydrogen, carbon, nitrogen, and oxygen, as well as a bit of sulfur in our protein. But then we also need a number of metals like sodium, potassium, magnesium, calcium, as well as phosphorus, chloride, fluoride. This one's a subject of a decent amount of controversy these days. Maybe we'll dispense with some of that. Interesting ones that people don't often think about: selenium and iodine are very important for antioxidant activity and metabolic activity. Things like copper, zinc, cobalt, iron, manganese, and molybdenum are all parts of proteins and enzymes. And then these vanadium, chromium, nickel, tin, arsenic, and silicon are what we would call conditionally essential, or they are found in our bodies, but scientists hesitate to refer to them as essential nutrients because supplementing them is difficult due to the incredibly trace amount that your body actually needs. We call things a major mineral if you need over 100 milligrams per day, or if there are 5 grams present in your body at any given time. These are calcium and phosphorus, which calcium is found in our bones. Phosphorus is found everywhere in our body. Magnesium is found in our teeth and our bones, as well as being essential for muscle contraction, along with calcium. Then you have sodium and potassium, which are both positive ions that help with nerve transmission and osmotic pressure of water in the intra and extracellular fluid. Chloride is important along with phosphorus as the counter anions for sodium and potassium, but also in making hydrochloric acid for our stomach. Sulfur, I said before, is involved in the bridging of proteins. Other ones that are trace minerals, which means we need under 100 milligrams, and there are less than 5 grams within the body at any given time. Selenium, which is important for antioxidant activity. Fluoride, which is important for bone structure, tooth structure, and bone structure. Iodine, which is important for metabolic activity. Chromium, which is important for insulin activity. Manganese, which is involved in a lot of enzyme reactions. And then zinc and copper, which have a bouquet of functions in the blood and in enzymes. And this is minerals generally come from the earth and are generally found in vegetables sources because vegetables pull minerals out of the ground with their roots. And this shows the relative amounts of various minerals in our body at any given time. Major minerals are shown. Calcium, there is over a gram of it in our body. Over 2 pounds of it. Phosphorus, there's 600 grams. Potassium, 210 grams. And onward and upward. This is just to show the relative amounts and how the comparison of trace minerals to major minerals. Notice magnesium is here. It's the lowest quantity of the major minerals. And its function is often overlooked in nutrition because of the fact that it is less abundant. However, it's essential for muscle contraction. It's a major component of a lot of enzymes, and it can be found in our bones, in our teeth. General minerals serve a number of functions in our body. The first function is part of energy metabolism. These ones are chromium, manganese, sulfur, selenium, and iodine. They're found in things like pasta and green vegetables. The essential electrolytes, which we're going to talk about, are the ones that help us maintain our hydration and muscle functioning. These are phosphorus, potassium, sodium, and chloride. Then we have blood fortifiers, which are iron, zinc, and copper. And then bone builders, which are calcium, phosphorus, magnesium, and fluoride. So the electrolytes. They're essential for hydration and muscle function. They attract water, which helps us retain water. Potassium and phosphorus exist inside of our cells. Phosphorus exists in the form of phosphate, which is part of ATP, and it's also part of cell walls and a number of other molecules. Sodium and chloride exist outside the cells, and they're the ones that pull water out. So potassium and phosphorus pull water in, and sodium and chloride pull water out of cells. And if you sweat or have diarrhea or vomiting, or if you bleed a lot, you might need to replace electrolytes. And these will be generally listed on labels of products that are intended to replace electrolytes. So generally phosphate and chloride salts as well as sodium and potassium, and in addition to calcium and magnesium, will often be in electrolyte beverages. So electrolytes help nerves to respond to stimuli. So nerve impulses are initiated in a nerve cell membrane in response to a change in electrical charge. And then the presence of the electrolytes allows for the process of depolarization and repolarization, which creates what we call an action potential, which is the way that signals are transmitted. Sodium and potassium ensure that the nerve impulses are generated, transmitted, and completed, which is shown here. So you have the intracellular fluids. This is the cytoplasm with phosphorus and potassium. And then you have outside the cell membrane with sodium and chloride. Then you have a stimulus, say from another nerve cell, and it comes in, causes sodium to move across the barrier, and potassium ions to move back and forth, and this creates an electrical signal, and this lets the nerve signal transmit along the length of the nerve cell and onto another one. Electrolytes also help signal our muscles to contract, so they are stimulated by nerve cells, and then this causes calcium to flow into the muscle, which causes the muscle to contract, and then the electrical signal gets interrupted by magnesium flowing into the cell, which pushes the calcium off, and it goes back and forth until we're done doing work. We've got a short video here which kind of illustrates that process. It doesn't show the magnesium involved because it's sort of a subtle thing, but this is a good little fun video. Anyway, yes, so we can see here that in addition to calcium, ATP is essential to the process of muscles contracting, which is just one of the many ways that ATP is involved in energy processes in the body. So, the regulation of fluid balance by electrolytes is accomplished because cell membranes are permeable to water, but not freely permeable to electrolytes, meaning that water can flow across the membrane, but salts generally cannot. The only way that salts can move is by specialized proteins that pump the ions from one side to the other. These are generally activated by the concentration of salt inside and outside of the cell, and the pumping of salt in one direction or the other, either sodium or potassium, causes water to flow by osmosis in an attempt to reduce the concentration of that mineral. This amounts to a pumping action where the transport proteins maintain various levels of sodium and potassium on the inside and the outside of the cell to cause the appropriate amount of water to be inside the cell membrane and outside of the cell membrane. Because the cell can only remain inflated and firm if it has enough water inside of it to compensate for the pressure of water outside of it. Now, this action of osmosis is demonstrated here, where we see the point at which an artery becomes a capillary, which is a thin blood vessel that allows water and oxygen to diffuse into and out of the blood. So we have blood pumped in from the heart. The blood pressure forces fluid across the wall at the start of the capillary, which allows small molecules, oxygen, glucose, amino acids, and salts to move out into the tissue. The fluid is forced into the tissues by blood pressure, and then the blood proteins and cells remaining become more and more concentrated, which causes the blood pressure to decrease. As the concentration increases, it starts to attract fluid back into it, and at this point, the capillary is increasing again to be a vein, which allows more fluid to flow back into the blood vessel to carry waste molecules away. Now, if you have low blood pressure, this process is less efficient. If you have high blood pressure, you can end up forcing too much fluid into your tissues, which can lead to things like edema. So the first mineral we're going to talk about is sodium. It's the major extracellular positive ion or cation, and it has the number of functions, including allowing cells to maintain fluid balance, regulation of blood pressure, transmission of nerve signals, muscle contraction and relaxation, and glucose absorption from the small intestine. We already saw most of these in action in the previous graphics. You need approximately 1.5 grams per day. That is the recommended average amount. Many health groups recommend no more than 2.3 grams or 2.4 grams per day. This is the amount above which you start to develop heart problems or high blood pressure. Sodium is found naturally in many foods. Generally, processed foods are much higher in sodium, and this includes restaurant foods, which generally far oversalt their food to make it more appealing to people. High sodium diets are associated with high blood pressure, and people with high blood pressure are often encouraged to do something called the DASH diet, which is the dietary approach to stop hypertension, which is a low sodium diet. Another thing that you can do is get yourself on a high potassium diet, which can also help lower blood pressure along with medications if it's severe. Hypertension is a major chronic disease characterized by high blood pressure, sometimes and often without symptoms. However, it increases a person's risk for heart disease, stroke, and kidney disease, and it can also reduce brain function, impair physical mobility, and cause death. You have hypertension if your systolic blood pressure is above 140 millimeters of mercury, and if your diastolic is over 90 millimeters of mercury. You can get a number of medications that can help normalize your blood pressure, but you should in general continue or begin to practice a healthful lifestyle. Consuming enough potassium generally decreases or prevents high blood pressure, which you get from fresh fruits and vegetables. You should never listen to somebody who tells you not to eat fresh fruits and vegetables. Hypertension is a silent killer because there are often no obvious symptoms. Therefore, it's important to get your blood pressure checked regularly, which is why you see those blood pressure checkers in stores, or maybe you don't see them anymore because of COVID, but you used to see them all the time. And if you go to the doctor and they hate you, they'll put the blood pressure measurement device on that tightly, and they'll squeeze up the little ball and it'll measure your blood pressure, and you'll hate it. But it'll be good because you'll either find out you have high blood pressure, in which case you can take steps to mitigate that, or you'll find out you don't have high blood pressure, in which case you can party. Now, this is a kind of a table of pressures that we consider to be hypertension. So a normal one is less than 130. Although nowadays they sort of say less than 120. You might want to check out your doctor. 120 over 80. Severe hypertension, which is the type of blood pressure where you are basically always at risk for a heart attack, is 210 over 120, which that's a rough place to be. Risk factors for hypertension include age, family history, a high sodium diet, obesity, although not all hypertension cases occur with obesity. Physical inactivity is a big one. The more exercise you get, the lower your blood pressure will be, because your body will be more regularly requiring cardiovascular work to be done, and your system will be strengthened. Excessive alcohol consumption will also cause hypertension. In general, you can prevent hypertension by, once again, consuming a diet rich in vegetables and fruits, also using low-fat dairy products, or reducing total saturated and total fat intake. However, the ansatz to that is that you need to not take in too little fat, because if you take in too little fat, then you won't properly repair tissues, and that will also not be good. You can reduce your sodium intake, limit your alcohol intake, exercise regularly, and lose weight. None of those things are easy except for the eating vegetables and fruits part. However, it's definitely worth it. Sodium is found everywhere, especially processed foods, table salt, but also MSG. One of the reasons the MSG is so dangerous is that it's sodium, and also combined with glutamate, which is an essential amino acid. So our bodies double crave it. However, you can easily overdose on amino acids as well. So take in 2 grams of glutamate, and you might be putting out a lot of ammonia into your liver. 1 teaspoon of salt has 5 grams of table salt, which is 2 grams of sodium. So you've already consumed too much salt for the day if you eat a whole teaspoon of salt in anything. Although if you were to actually put a whole teaspoon of salt in a food, I'm sure that you would spit it out because it would be disgusting. And this shows a table of level of processing versus potassium versus sodium content. Shown here, there's milk and meat. So a whole milk generally has a lot more potassium than sodium. Something like chocolate pudding has about an even amount, and then instant chocolate pudding, which is even more processed, has significantly more sodium than potassium. Same with meats. So a beef roast has a lot of potassium and a little bit of sodium. A beef roast, or a corned beef, has a lot of sodium and very little potassium, as well as chipped beef, which has even more sodium and even less potassium. Now the ion that's opposite sodium is chloride, which is the major extracellular anion, and it functions, in addition to helping with fluid balance, it aids our digestion by being the main component of hydrochloric acid in the stomach. It also assists the immune system because chloride can combine with oxygen to make something called hypochlorous acid, which kills bacteria and antigens in our blood. Chloride is also involved in the transmission of nerve impulses. And we want to get about 2.3 grams a day, which is very easy to get if we consume things like table salt or soy sauce. Also, there is some in meats, eggs, and large amounts in processed food. Now, potassium is the major intracellular cation, and it acts together with sodium to maintain fluid balance. It regulates transmission of nerve impulses and muscle contraction. It also helps maintain a lower blood pressure and prevent high blood pressure. We need a lot more potassium than sodium in a day. We need 4.7 grams, which is roughly double or triple the amount of sodium that's recommended. We get potassium from fresh fruits and vegetables, as well as legumes and whole grains, and processing foods increases sodium and decreases potassium. Here's a picture of potassium-containing foods. And then phosphorus is the major intracellular anion, and it functions to maintain fluid balance, as well as being critical in formation of bone and regulating a number of biochemical reactions by activating enzymes or deactivating enzymes. This is known as phosphorylation. It's also found in ATP, DNA, RNA, cell membranes in the form of phospholipids and lipoproteins. So it's basically everywhere. We want to get about 700 milligrams a day, and it is found in many foods, so a deficiency is unlikely. It's often fairly high in protein foods like meat, milk, and eggs, and it's more readily absorbed from animal sources than plants, although it is found in plants in the form of phytic acid in beans, whole grains, and nuts. It's also, interestingly enough, found in soft drinks in the form of phosphoric acid. And here are some pictures. Sesame seeds and cashews are pretty delicious, so you should have no problem. Now, if you don't get enough electrolytes, you can experience a number of disorders as a result. Dehydration is the obvious one, but if you don't have enough fluids, then you can't properly maintain your temperature, and you might experience heat stroke. If you are retaining fluid too much, you might experience water intoxication or hypertension. If you are low on fluids, you might experience neuromuscular disorders or kidney disorders or congestive heart failure or obesity. Now, dehydration occurs when fluid loss exceeds fluid intake, and it's commonly due to heavy exercise or high environmental temperatures. And elderly people and infants are at increased risk of dehydration. So, that is it for electrolytes. So now we're going to move on to antioxidants. And this is a kind of an involved discussion, but it doesn't involve a ton of minerals, but it does involve selenium, which is one that nobody really ever talks about. There are 5 general antioxidant substances that we talk about in terms of nutrition because they have well-known mechanisms in our body. Vitamin E is something that protects lipids from free radical damage. If you remember, lipids make up all of our tissues, so if we have damage to our tissues, vitamin E can repair it. Vitamin C, in addition to scavenging free radicals, which can prevent tissue damage as well, it regenerates vitamin E. So a lot of vitamins work together in these kinds of systems. Beta-carotene also scavenges free radicals and can protect low-density lipoproteins from oxidation, which can cause a lot of damage because low-density lipoproteins circulate throughout the body. Then vitamin A is under investigation as an antioxidant, but it's very important for vision, and its structure in the eye is something we're going to talk about. And selenium is part of something called the glutathione peroxidase antioxidant enzyme system, and that's a lot of complicated words to just say there is a protein called glutathione, or rather it's a peptide enzyme, and it goes around and basically repairs vitamin C and scavenges free radicals in the blood, and then selenium participates in this reaction. So we're going to talk about what actually happens when an antioxidant protects you from free radicals. So sometimes you have oxygen and it gets an extra electron from the mitochondria, from the electron transport chain, and it generates something called a free radical. So we have an extra electron that's got a lot of energy, and it wants to react with things, and it reacts with the first thing it sees and steals an electron from it. Usually the first thing it sees is a lipid from a tissue or a protein. So the tissue molecule lipid now has lost an electron, it has an unpaired electron, and it is now a free radical itself, and it can go on to cause chain reactions and rip apart your cells. Now, if antioxidants are present, then instead of that, vitamin E comes in and deactivates the lipid, and then breaks apart and becomes inactive, which is fine because it's not a free radical. Then vitamin C can come in and restore vitamin E to its active form so it can go back and do its duty. Meanwhile, the vitamin C can go off and either be excreted or readily gain back its molecules or its hydrogen atoms to go on to help more vitamin E's protect you. Vitamin E, we've talked about before, but it's called alpha tocopherol, or tocotrienol. It's an antioxidant exclusively. It stabilizes cell membranes, regulates oxidation reactions, and it protects polyunsaturated fatty acids, as well as vitamin A, which is vitamin A is a sensitive molecule. If you have a deficiency of vitamin E, you'll generally experience red blood cell breakage and therefore anemia, as well as degeneration, weakness, difficulty walking, and leg cramps. If you get too much vitamin E, the only known negative effect is that it will augment the effect of anti-clotting medication. It might also make it harder for your blood to clot. You generally find vitamin E in plants that have a lot of polyunsaturated fatty acids, such as plant oils, and then you get it from leafy greens, vegetables, wheat germ, whole grain products, liver, eggs, yolks, nuts, and seeds. Here are some foods containing vitamin A. Now, vitamin C, also known as ascorbic acid or anti-scorbutic factor, if you really want to impress people at parties, if we ever have parties again. This one has a long and storied history of being deficient in soldier populations, and as well as the population at large. So between 1556 and 1857, there were 114 scurvy epidemics. However, in 1744, Admiral Anson of the British Navy lost most of his men to scurvy, and therefore in 1804, the British Navy adopted the use of lime rations for crew, which gave them the name limeys. And then it must have caught on sometime around 1910 to 1921. We finally figured out how to extract the anti-scorbutic factor from lemons, and then we named it ascorbic acid in 1922. The process by which vitamin C acts as an antioxidant, it's got these two hydrogen atoms that are readily removed and given away to vitamin E, and then it's left behind in this form that can easily get two more hydrogens back from basically anywhere, but is a stable molecule in and of itself. And we mentioned that it's also involved in collagen synthesis. So besides being an antioxidant, it helps you build back up your tissues, including blood vessels and bones. It also is involved in thyroxine synthesis. So thyroxine is a thyroid hormone, which is involved in metabolic regulation. It's involved in amino acid metabolism and strengthens our resistance to infection, as well as helping us absorb iron and acting as an antioxidant. You need about 60 milligrams a day, unless you're a smoker, in which case you need 100 milligrams. You can get anemia and atherosclerotic plaques if you don't get enough. Pinpoint hemorrhages, suppression of the immune system, frequent infections, bleeding gums, losing teeth, muscle degeneration. This is all just scurvy. And humans can't synthesize vitamin C. It's one of the few animals that can't, so this makes it an essential nutrient. If we get too much, it can cause nausea or abdominal cramps, diarrhea, headache, fatigue, insomnia, hot flashes, rashes, interference with medical tests, aggravation of gout because of the involvement with the thyroid, and urinary tract problems, and kidney stones. But if you don't get it, if you get plenty of citrus fruits or cabbage-type vegetables, there's a lot of vitamin C. Interestingly enough, cabbage is a very popular crop in the north because citrus fruits don't grow there. Another very popular crop in the north are berries and roses. Rose hips actually contain the most vitamin C of any fruit that grows north of 60 degrees latitude. So then a lot of other vegetables and fruits like cantaloupe, strawberries, peppers, lettuce, tomatoes. Tomatoes have a lot of vitamin C in them. Potatoes have a decent amount of vitamin C in them, as do onions. And you may have heard of this guy named Linus Pauling, who won the Nobel Prize in Chemistry in 1954, as well as the Nobel Peace Prize in 1962. He was obsessed with vitamin C. He published a thing called Vitamin C and the Common Cold in 1970. He was very prestigious. He took 18,000 milligrams of vitamin C daily, although I would never recommend that for anybody. Because in general, you need 10 milligrams a day to prevent scurvy. You need 30 milligrams a day to support your metabolism. The RDA for men and women is between 75 and 100. If you smoke, you need a little bit more. Once you get above 200, you don't absorb it very effectively, and it can cause an increase in blood concentration. You don't want to really get much more than 2,000 milligrams, because above that, you might experience adverse consequences. Vitamin A is known as retinoic acid, or provitamins like beta-carotene. The main function is vision and maintenance of the cornea, which is where its antioxidant activity comes in. It helps with epithelial cells and cell membranes, as well as mucous membranes, skin, bones, and tooth growth, as well as reproduction and immunity. If you don't get enough of it, we call it hypovitaminosis A. When we get vitamin A from our food, we either get it in the form of retinyl esters in animal foods or beta-carotene in plant foods. Retinyl esters get converted directly into retinol, which supports reproduction. Retinal participates in vision, and retinoic acid regulates growth. And they can be readily interconverted, although the pathway from retinal to retinoic acid is irreversible. And you don't need to know the chemistry of these, but this just shows how they're all basically the same molecule with a slightly different terminal group, except for beta-carotene, which is 2 retinol molecules. It can split in half to make 2, or it can split in half inefficiently to yield only 1. The reason this means that you need a lot, if you're going to get beta-carotene as your only source of vitamin A, you need to get significantly more of it because of the inefficiency of this process. And if you don't get enough, so the symptoms of hypovitaminosis A are cessation of bone growth, painful joints, impaired enamel formation, cracks in the teeth, that's no fun, tendency to decay, atrophy of dentin formation, anemia, night blindness, that's a big one since it's involved in the eyes, changes in epithelial tissue, also known as hyperkeratinization, drying, which is known as xerosis, triangular gray spots, also known as Beto's spots, irreversible drying, also known as keratomalacia, and corneal degeneration, which leads to blindness. And then xerophthalmia, which is blindness caused by vitamin A deficiency. More deficiency symptoms, so we can see how important this vitamin is. Plugging of hair follicles with keratin, formation of white lumps, also known as hyperkeratosis, changing in the lining of the GI tract, diarrhea, suppression of immune functions, frequent respiratory, digestive, bladder, vaginal, and kidney infections, brain and spinal cord growth too fast for stunted skull and spine, and kidney stones. This is what hyperkeratosis looks like. Interestingly enough, vitamin A is a fat-soluble vitamin, so you could be consuming the RDA for vitamin A, but if you are very obese or even a little obese, you might be storing a large amount of vitamin A in your tissues and therefore not getting it into your body. Now, this shows the difference between a person with normal vision and somebody who has poor night vision due to a low amount of vitamin A in the diet. You can see here how much darker it is for the same amount of light in these two pictures. So the way that vitamin A works in our eye, we have something called the retina at the back of our eye, and the retina has molecules in it called rhodopsin, which is what the cells are made out of. This is a combining of the protein molecule opsin and retinol, or cis-retinol more specifically, which is vitamin A. Cis-retinol is retinol that's bent like this. And then when light comes in, it bends the molecule to be like that, and then it flips back and forth, and that's how you absorb light and see. If you don't get enough vitamin A, you literally can't make rhodopsin, and therefore you can't see. Now, on the converse, you can also be toxic in vitamin A if you get too much. This is called hypervitaminosis A. And this can lead to an increased activity of something called osteoclasts, which we'll talk about when we talk about bone health, which will cause decalcification of your bones, joint pain, fragility, stunted growth, thickening of long bones, increased pressure inside the skull, mimicking a brain tumor, headaches, loss of hemoglobin and potassium by red blood cells, cessation of menstruation, slowed clotting time, easily reduced bleeding, dryness, itching, peeling, rashes, dry scaling, cracking and bleeding lips, nosebleed, loss of hair, brittle hairs, nausea, vomiting, abdominal pain, diarrhea, weight loss, overstimulation of immune reactions, loss of appetite, and irritability. Now that sounds like the back of a prescription pharmaceutical, but it's just a lot of terrible things can happen, especially with the vitamin A. This is one of the most delicate vitamin balances in your body because it's fat soluble. Your body stores it, and it's just really important to keep track of because you don't want either of the toxicity or the deficiency symptoms. There's more. So fatigue, insomnia, restlessness, headaches, blurred vision, nausea, vomiting, muscle weakness, interference with thyroxine, amenorrhea, which is the cessation of menstrual, jaundice, enlargement of liver and spleen, massive accumulation of fat, and vitamin A in the liver. So no fun. Generally, you want 1,000 micrograms per day, or 800 if you're a woman. That's not very much. That's 1 milligram. You can get it in the form of a vitamin A supplement, as well as vitamin A fortified milk. It's also found in cheese, cream, butter, fortified margarine, eggs, and liver. You can find beta-carotene in things like spinach and other dark green leafy vegetables, as well as deep orange fruits and vegetables. Now, interesting thing about vitamin A, because it's so involved in vision, the British were able to trick the Germans during World War I. They said that the pilots were eating carrots to improve their vision, which may or may not have been true, but in reality the reason that they were doing so well is because they had invented radar. And this is a picture of food that has vitamin A in it. You can identify it by the bright yellow or orange color. And this is a graphic that shows foods that give you at least 10% of your vitamin A for the day. A glass of fortified milk has 17% of your daily value. Beef liver has 1,000% of your daily value. Cooked carrots have 106% of your daily value. Mango has 28%. Sweet potato has over 100%. Apricots have about 15%. Spinach has about 41%. So it's really not difficult to get enough vitamin A. Although if you're chowing down on liver all the time, you might develop toxicity. And here's more food. And so now we're back to the minerals. Selenium is a big part of the enzyme system that I mentioned before, the glutathione and antioxidant system, glutathione peroxidase specifically. And this works with vitamin E to protect your body compounds from oxidation. So basically it's a set of a chain reaction or a Russian doll of enzyme or antioxidant activity. Vitamin E protects your tissues, vitamin C regenerates vitamin E, and then selenium and glutathione regenerate vitamin C and scavenge free radicals, which can help us prevent cancer. However, selenium is one of those minerals where if you consume it in excess, it will just kill you. And so nutritional scientists generally hesitate to recommend supplements for selenium for this reason, although you might find selenium in supplements sometimes. So here's a picture here. You have a free radical. It gets deactivated by vitamin A. Vitamin E becomes a radical. Vitamin C makes it not a radical and becomes dehydroascorbic acid. And then glutathione gives its hydrogens to vitamin C to become oxidized glutathione. And then selenium comes in and deoxidizes the glutathione. We need 70 micrograms per day, or 55 for women. You get this from seafood, meat, and grains. Selenium deficiency leads to a predisposition to heart disease, characterized by cardiac tissue becoming fibrous. And the toxicity symptoms are digestive system disorders, loss of hair and nails, skin lesions, nervous system disorders, and tooth damage. And finally, copper, iron, zinc, and manganese all play a peripheral role in antioxidant function. So there's something called superoxide dismutase. So another form of oxygen that can be formed is the superoxide ion, and it can be converted into less reactive forms, such as oxygen and hydrogen peroxide, by copper, zinc, or manganese. And then hydrogen peroxide is broken down by something called catalase, which contains iron. And this is it for today's lecture. So we've talked about water, we've talked about electrolytes, and we've talked about antioxidants. This sort of gets us to the halfway point of the semester. I know I didn't finish talking about all the minerals, but there's a lot of them, and so what we're going to do is next time launch into a more detailed discussion of the cardiovascular and musculature systems. And then we'll probably hit all of the rest of the minerals that are relevant for this class and move on into the late semester material. Once again, thank you for tuning in, and I hope everybody's having a good time with the class.